Hello and welcome to EJC News Focus. This autumn, Amsterdam will see the biennial European Cancer Congress, or to give its full title, the 17th ECHO, 38th ESMO, 32nd ESTRO European Cancer Congress, organised in partnership with ESSO, EACR, EONS and CEOB. It's European Oncology's premier multidisciplinary gathering, and to push the point even further, the slogan for this Congress is Reinforcing Multidisciplinarity. But we've been talking about multidisciplinarity for years now, even decades. I met one of the scientific chairs, John Yarnold, at the recent ESTRO Forum. I asked him why we still need to emphasise multidisciplinarity.
Multidisciplinarity is recognised increasingly as an essential component of all modern medicine and cancer treatment. And it's been shown again and again over the decades in different countries around the world that if people meet on a regular basis, typically weekly, to discuss all the new patients that are newly diagnosed, then treatment decision making becomes more consistent. It becomes more focused on the patient rather than on the particular vested interest maybe of one professional group or even one personality over another.
What are the benefits of this way of working from the patient's point of view?
I think the most obvious outcome of multidisciplinary meetings on a regular basis would be that decisions are made in a consistent fashion, so that there is consistency. The same type of condition and the same type of patient that presents to a particular department is treated in a consistent way. Now, guidelines are there as guidelines, so there has to be flexibility for them to be effective. There has to be flexibility on paper, and more importantly, there has to be flexibility in relation to the opinions, the expert opinions, which can and do differ, of course. And so the skill is to moderate that discussion so that it doesn't become a competition of one individual, one specialty against each other. And that sort of give and take and mutual respect is probably provides for me, and in my experience, the biggest safeguard for patients against decisions which are clearly inappropriate to them. And even though the patients, at least in my clinic, are not present at the multidisciplinary meeting, there are several nurse specialist oncologists, for example, psycho-oncologists, people that have a very direct link to the patient in a different setting to the oncologist, the medical oncologist. And so they can act as a moderating influence if they feel that their colleagues are actually considering some treatment modality which would be, or option, which they consider the patient would find very, very difficult to accept.
It sounds quite a wholesale cultural shift.
Yes, and I think it's been difficult for some individuals, for some specialties, but I think in its most advanced forms, it becomes a community that is actually a group of equals. And of course it does require leadership, but it requires a special kind of leadership that is actually where the skill is one of inclusiveness rather than, if you like, domination. That's not to say if it doesn't happen, things fall apart. That's quite clearly not the case because, cancer mortality statistics are falling right across Europe, and that's a very positive thing.
Could you give us an example when, for you, being at a multidisciplinary meeting has really made a difference?
It happens quite frequently, and that's the fun of attending a meeting. Whether it's a light bulb moment or not, but just yesterday afternoon, we're speaking here in Geneva at the ESTRO Forum. We had a very good multidisciplinary session on radiation sensitivity and the genetic basis of adverse effects, which is a very important theme across the whole of medicine, not just a radiation oncology. What determines the great variation in the response of patients, the adverse effects of our treatment modalities. And talking with colleagues, scientific colleagues from France, it's quite clear that there would be scope for interactions with laboratories in France, and we have discussed setting up projects together based on clinical samples that we have collected in the United Kingdom, for example, from clinical trials, where we have, for example, fresh blood samples linked to high quality outcome data from clinical trials, and so that would be just an immediate example that springs to mind. Yeah.
How will the European Cancer Congress make a difference?
Typically in tracks which maybe focus on diseases rather than on technologies such as surgery or medical oncology or radiation therapy. So they focus on multidisciplinary sessions which deal with the important clinical problems, to a multidisciplinarity which is more orientated towards the research field, the interface between day-to-day clinical medicine and the way that research operates, and the multidisciplinarity between the clinical and the scientific spheres. Okay. Now, clearly with basic science at the molecular and even in the submolecular level, then basic science can operate very effectively independently of the clinical arena, and does, of course, because its questions are so different and so remote. But the closer you come to questions which relate to clinical problems, the more it can be helpful to the scientist and certainly to the clinician to actually have a context in which one meets and discusses. And so one tries to design tracks that actually encourage that interface and scientists and clinicians engaging with each other in an effective way, and also presenting the fruits of their research, not just a sort of a demonstration in how communication is possible. It's much more serious than that. So the fruits of the research are very much present at the meeting.
This year's European Cancer Congress, then, looks set to enable collaboration between disciplines. There'll be presentations of data to a wide field, and it will perhaps foster some new cross-specialty studies. And with thanks to John Yarnold, that's it for this month's EJC News Focus.